Welcome, everybody. This is Larry Green, your host for the Aesthetic Water Cooler series. We are talking today about how to be an effective learner and how to never stop learning, the importance of staying current with the latest treatments. And we're physicians, so of course we never want to stop learning. That's something we were born and bred to do. So this should be a topic that we can all relate to, and I want to thank Equa Marketing, the leaders in digital marketing for dermatologists, for sponsoring this water cooler. And previously, we talked about in this advocacy series, we talked about being an advocate for the specialty of dermatology, which I'm in. We talked about being an advocate for our patients, which I think every physician should do. So important. We talked about how to be an advocate in the federal and state legislatures, how that's so important. And then last time we talked about how to do clinical research, how to advocate for yourself to do clinical research, and lots of tips about doing clinical research in your office or wherever you work as a dermatologist. But what I'm going to concentrate on now or today is never stop learning. We're doctors and we want to be an advocate for ourselves or for ourselves as learners, or learning it for our patients, for ourselves, learning for our business, to grow our business, different ways that we do it and why it's not important. And a lot of this may overlap with stuff we've talked about, because what we talked about when we talked about being an advocate for the specialty or our patients, or in legislatures or for clinical research, that all involves learning too. All involves learning. And it's something that we have to continue to do. I'm going to start with a story. Maybe I'll end with the same story too, because I think it's a good story, about the mother of a Nobel Prize winning physicist. And when this Nobel Prize winning physicist won, I don't know if it was him or her, award, Nobel Prize, they told a story about why learning was so important to them and what made them think about learning, and why they continually want to learn and strive. Someone who wins a Nobel Prize obviously is never stopping learning, because you're always it's quite an achievement. And this is the story that the Nobel Prize winner related. He said, when I was younger, my mother didn't treat me the way a lot of parents treat their children when they come home from school. Not treat, but ask about how things were in school. So when my kids came home when they were younger from school, as a parent, you want to know what's going on in school. You want to know if your children are engaged. And I would always ask, how was your day at school today? What did you learn? What did they teach you about? Because that's what school's all about. It's about learning. And as a parent, I thought it was a good question, but you know what? They are better at questions. Because what did my kids always say to me? They said, I don't know. We learned something. They were hungry, ready to eat dinner. And maybe the timing is off. You don't want to ask when the kids are hungry. You want to ask maybe when they've eaten, but then they always want to run off. So that's another issue altogether. But this physicist related the story, and the physicist said his mother, her mother, whoever, their mother, always asked them, what questions did you ask your teacher today? Instead of saying, what did you learn in school today? They said, what questions did you ask your teachers today? I think that was brilliant. And I wish I would have thought of that or learned this story before my kids were younger. Because I think that encourages learning. When you ask an open-ended question, what questions, when you ask an open-ended question, like, what did you learn in school today? It's too open-ended. But when someone's learning, you want to ask questions. You want to think about questions. You want to probe further. You want to see where you can go from that. That asking questions is really the title of this talk, Never Stop Learning. And I'm going to start with that because I think that's a good way of opening this topic, because we want to think about where we can go and never stop learning and continuing to ask questions. It's not what did we learn today? It's what more could we learn tomorrow or later today? And that's what learning, I think, is all about. And that's a good way to summarize, and I'll come back to that, this story at the end of our talk. But I want to open it that way because I want everyone to open their minds and think about that as we go forward and through this water cooler session. So we're physicians. We know we need to learn. We know it's important. We're always reading. I don't know about you, but my vision was 2020 till I went to medical school, and I was sitting in the lecture hall. That time they used chalk in lecture halls on chalkboards. They don't do that anymore. But I noticed the chalk was getting thinner and thinner that the professors were using, and that was not getting thinner, was my eyes were going bad. But so I needed my first set of glasses to see distance. But that's constantly trying. It's learning and probably had it related to learning on a chalkboard. But we're always reading, always seeing things, always learning. And that's from school and medical school. Of course, we have to keep up to date. If we don't keep up to date, we're not going to grow. We're not going to be the best doctors we can be for our patients. It's so important to do all those things. And then, there's different ways of learning, and I'm going to talk about that over the next however many minutes we have in this water cooler session. We're going to talk about different ways of learning and what we have to do as physicians, as dermatologists, to learn and what we go through in order to grow. Always asking questions. That's the best way. What can I learn tomorrow? It never ends. So, and also I've noticed as I get older is that I don't retain as much information as I used to when I was younger. And so it's even harder, but you have to constantly review and continue to ask questions and remember. So I guess I'll add on to that learning is not just about what can I ask questions about tomorrow, but it's also review. It's reviewing what you learned, because you go forwards and you go back, especially, like I said, as I get older, to help yourself retain what you have and learn and grow. So I think, we start in medical school and we learn, and having our practice presents us with the opportunity to continue learning as physicians. But I think and I want to divide it up into different ways of how we learn, or what we need to do to learn, I should say. And I'll set up the sort of bullet points now, and then we'll delve into each one. I think we have to, and this is again review, we learn to be able to advocate for our patients. And that's something we have to continue to do. And that's learning about advocacy. And we talked about that in an earlier water cooler session. But that's part of what doctors need to do to progress. It's not put your head in the sand and just write prescriptions and see patients all day. It's learning how we can help them, how we can help them get what they need to get better. We'll talk about practice management, really running a practice. And this is the business of learning is so important. It's something that we as physicians really didn't get in medical school at all. At least I didn't. And we can do a whole water cooler series on the business of medicine and the practice management we have to do. I mean, I'm not going to go into that today, except to give an overview of why doing that is important. Learning is important in that part of that part of our growing and helping our patients in our practice. And then, of course, there's changes in disease diagnosis, therapy, all those things, and the myriad of ways that we try and keep up with that, which I'll get into as well. And then I think we can talk about how important, I think it's important to have mentorship in our lives. That's another thing I want to get to towards the end, because mentorship is an easy way of learning, I think, but so important. And I think it's just as important to be mentored as it is to be a mentee. And you want to be both, because that's a way we can grow and have someone we can trust and sort of pay it forward as well. And I've learned as a mentee and I've learned as a mentor. The mentor learns, I think, almost as much as the mentee. So we'll talk about that as well. So that's how I want to break it down and talk about learning. But again, as we go forward, I want everyone not to forget what I've learned recently from someone else that I think is so important. Again, is when you're learning, think about what questions you can ask yourself about what you're learning to move to the next step. Okay, so let's talk about something that I think is very important, is being an advocate for our patients, learning advocacy. And this is, like I said, a little bit of review, but being there for our patients is so important. That's why we're physicians. And in today's medical world, being there for our patients is more and more difficult than it was. You know, back in the day, when the day was probably 40 years ago, 30, 40 years ago in the late 20th century, it was private insurance. There was no managed care. Doctors would charge X. The patient's insurance company would pay X. Doctors would order tests, whatever. The patient's insurance company would pay whatever. It was as simple as that. I write a bill, the bill gets paid. All you have to know how to do is send out a bill. Well, that's not like that anymore. Patients have formularies, and doctors have formularies that they have to write for the patients. We have prior authorizations. We have step therapy to go through to pick a medication that we want to use for our patient. That we have to go through other therapies that patients have to fail before our patients get what we want. So we learn and we keep up, and we'll get into all this, but no matter how we keep up, we can't do what we want. We have to be advocates for ourselves and for our patients. And we have to learn how to do that. To go into practice and just write a prescription and give it to the patient, and the patient goes and gets that prescription filled, those days are gone. Just like the days are gone when we write a bill, we send to the patient's insurer, and the bill gets paid. Those days are gone, long gone. So as a physician, we have to learn how to take care of that. We have to learn. We have to continually fill out forms and ask questions to the insurer, to the pharmacy, is why the prescription is not getting filled. Why can my patient not get what I think is best for him or her? Those are things we're forced to learn in a way. These are things we're forced to learn if you want to practice medicine. Now, there are ways around that. You can have people do it for you. I mean, you can hire staff to do that if you're so inclined. But still, to some degree, you still have to learn how to do it. I mean, the staff looks to us as a physician as for the ultimate answer to their questions. So we have to have, if we need to ask questions to answer their questions, and that's something we have to do. So prior authorizations, filling out the forms, those are things we have to do. We have to sometimes know and learn what are the standard therapies that a patient may have to fail from a particular insurer. Those are things we have to do. That's part of advocating for our patients and ourselves, because how can we see patients and help patients without letting them get what they want in terms of advocating? And then then you can learn how to advocate for your patients, like I talked about before, at the state and federal level. You know, advocating for bills that'll make our lives easier, advocating for regulations that will make the safety of our patients better. Those are things we talked about in earlier sessions on being advocates for our specialty and our patients, and how to advocate in our legislature. Those things I think are very important. I can't stress that enough. It's part of the practice of medicine, and in our case, dermatology, is that we need to learn about advocacy in that to help our patients. And that never stops. It always changes. We have to teach. We have to teach our legislators as well about why our patients need to have step therapy overrides, why our patients need to have less prior authorizations, easier access to the medications that will help them. So those are things in terms of advocacy. Let's talk for a bit about practice management. That's something we continuously have to learn to do. You cannot have a practice and not learn something about practice management. Again, you can hire people to do that, but the buck stops with us. We're the physicians. We're the team leader in terms of helping run the office. And we can have help. We can have other physicians help us. We can have nurse practitioners in our office help us, or PAs, physician's assistants help us. But the buck usually stops with the doctor, the owner of the practice. Now, doctors are selling their practices a lot. Well, that's something else to learn about. I'm not even going to go into that. But if you want to sell your practice to a big business entity, then you have to learn how to do that. Again, you're going to hire, we need to hire attorneys, but that's learning about all the business of medicine in that respect as well. If you want to have less practice management on your mind, there's another way, another avenue of learning that one has to do. So I think, no matter what, we need to learn and grow and never stop learning in that respect. So let's get back to practice management. Say you're not selling your office. What have I learned about running an office for over 20 years? My own office. I've learned that you need to learn a lot and keep up. You think of the things about running an office that a doctor has to do who's just starting off. I know a physician and dermatologist who just left her practice after many years, wants to go up on her own, go on her own. And it's overwhelming what you have to do, what you have to learn to do. Again, this is not taught in medical school. This is something that you have to figure out on your own and learn on your own. The business and the practice management of medicine. You have to get a tax ID. You have to sign up with different insurance companies. You have to wait for that to happen. You have to fill out those forms. You have to get a CLIA certificate if you want to do KOH exams in your office, potassium hydroxide exams. And you pay that fee every year. You have to, of course, make sure you have a state medical license. You have to make sure you have a lot of states have CDS certificates, DEA certificates, a state certificate to write for narcotics in your state. And as a dermatologist, I really don't write for narcotics, but it's still important to have that certificate. Of course, you have to have an MPI number through Medicare. You have to sign up for Medicare. And of course, you have to get, like I mentioned, you have to get a tax ID to do that. How do the patients come in your door? How do you learn how to get patients in your door? That's a whole nother step that you have to do. And then once you have all that set up, there's billing. Like I mentioned earlier, it's not that you write a bill and the insurance company pays it. There's all sorts. We have to know how to do billing coding, ICD-10 coding. How do you learn that? Well, computers can fill that out for you. But again, computers don't know everything. Again, the buck stops with the dermatologist, and there may be a better code and better ways to bill. And of course, we have to know coding. What constitutes the right? Again, this is not stuff you learn in medical school. What constitutes the right codes to use in a given patient's office visit? What's the right code and modifiers to use for procedures? Those are things we have to keep learning and make sure we do it right. And then we bill insurers, and they may not, not every claim comes to them. Claims are lost. I don't know how, when it's electronic especially, but claims are lost. Modifiers are dropped for whatever reason, the modifiers we put on. So these are things we're forced to learn in order to stay in business. Those are things that we have to learn. And we have to ask questions if we don't understand, because otherwise we're not going to get paid. We're not going to earn our living. So it's not just about being a good doctor, it's about making a living as well. And so those are things we're continually being asked to do. And of course we have with all the macro, which started a few years ago. We have to learn how to do macro. We're all doing MIPS reporting as dermatologists probably. And as you know, the MIPS measures are used to meet the reporting requirements for the CMS, which is Medicare's quality payment program. And we have to do that every year in order, if we see Medicare patients and we want to get paid from Medicare, we have to do this type of reporting. If you make over a certain amount from Medicare every year, most of us do, especially if we treat skin cancer. So those things we have to continue to learn. That was just thrown on us a few years ago. Whole bunch of learning to do with that. We have to do quality measures, improvement activities. Some of the quality measures now are biopsy follow-up, melanoma, continuity of care, recall system, checking for tuberculosis in patients take biologics, make sure we have pathology reporting to our patients and from the pathologist in a timely fashion, medications. Those are things, we make sure we use EMR or things we have to do. It just keeps going in order to qualify for Medicare payments in that respect. And there are things on, for example, the American Academy of Dermatology website. I think it's a great resource for learning about MIPS, and as part of the MACRA, which is the Medicare Access and Reauthorization Act of 2015. That's what MACRA stands for. And MIPS is the pay for performance program that uses measures a way to collect data, because that's what Medicare really wants to do and they collect data on the quality of care we provide for patients. It's all about that, and it starts with using electronic medical records, EMR. But those are things we have to learn. I'm not going to get into how to do that. It's a whole other topic. But those are things we need to do to constantly learn. All these changes, all these things we have to do in order to stay in business. But the resources are there. And again, I would encourage everyone who wants to learn more about that to go to the American Academy of Dermatology website. Everything is there. And how to do it, and the tools to use so that we can get paid for the job we do, which is the bottom line of what we want, and it's just learning to get paid is the way I look at it. So we talked about learning as an ongoing process. As physicians, we have to learn all the time. Very important. How can we not learn? We talked about how that starts in medical school, and we talked about being an advocate for our patients. We talked about practice management and things that are forced on us that we have to learn in terms of coding and how we need to get paid and fill out certain paperwork and forms. All that's so important. But I think the most common type of learning that we really do is learning how to be physicians for our patients, the best therapy for our patients. And changes in disease, diagnosis, and therapy comes all the time. And I think that's where we really get into the focus of learning, where we want to continually ask questions. What questions can we do to go to the next? What questions can we ask to get to the next level? What's the next step? That's what learning is all about. We can't say we've done the final step. There's never a final step. There's always a way around, and as much as we can. We always want to try. Sometimes the questions don't have answers, but it's always, I think, important to try. That's part of what learning is. And again, that's being an advocate for our patients, but it's really bettering ourselves. That's what we want to do. It's really about the self to be the best physician we can. That the athlete wants to be the best athlete that they can. We want to be the best physician that we can. Why do we want to be sitting on the bench? That's not what we want to do. That's not what it's like. It reminds me of the commercials that are popular now, where someone asks the doctor if they're qualified for a certain procedure, and have you done it before? And the doctor says, "Yeah, I played around with it." "Are you good at it, doctor?" "Well, I'm okay." I don't know if anyone recalls that commercial, but anyway, you don't want to be okay. You don't want your doctor to be okay. No one wants their doctor to be okay. Being on the bench, being a sixth man, that's not good enough. We want to be starters. We want to be there for our patients. And the people who succeed are the ones who practice the most. And for us, that's about learning. It really is about learning. Learning about everything we talked about, but especially about learning about the new things that happen in medicine. And doing clinical research, I think, is one great way to learn because you learn about things, you know about things and mechanisms you have to know. If you're going to do the research, you have to know about the product, what it is, what it does. If you're going to prescribe it, you have to know about it too. But when you're doing clinical research, you're doing that first, and you're learning about the products first and all that's out there. So that's one way I think of staying on the forefront of what's going on, being on the first team to help for our patients. So then there's reading. We as physicians have to read all the time. How many journals do we get a month? Oh, and there's throwaway journals and there's real good, quality medical reading journals. How many do you think we get? Like 15, 16 a month? That's a month. So this is after a long day of work, we all come home and we have our kids to deal with and family things to deal with. And then we have 15 journals a month to read, 16, whatever, 15 plus journals a month to read. It's part of learning. We don't have to read them all. And I'm not saying we should read them all. Of course, we have to read the most important ones. But it's all learning. Everything we read, you never know what you're going to get out of it, what you're not going to get out of it, what you could gain from that. And that's the way I look at it. Even if it's the most basic throwaway journal, you never know what point you can get out of there that may help your patients. Just like the athlete, again, I'm using that analogy, wants to get the most out of shooting every free throw, every little motion that goes through it, so it's so routine. And again, there's always stuff to learn. But you want to keep reading. I mean, you just never know. And journals are a big way to do that, even though there's, like I said, 15 plus journals a month to go through. What about something like grand rounds? Grand rounds are where many minds get together, and there's always a lot to say about getting together with a bunch of minds because, I go to committee meetings all the time, meetings for the American Academy of Dermatology Association or the ASDS Association, and I'm amazed at how minds think differently and come up with great concepts and great ideas. Always amazed. I shouldn't be amazed, but the way I think is not the way everyone else thinks. And the concepts and ideas I come up with are fine, but I don't think other people think of great things. I just, wow, I wish I would have thought of that. Just like people invent things, it seem to be so obvious, but we just don't think of them because different minds think differently. And how well you can learn in a situation like grand rounds where there's however many plus dermatologists together to help a patient think of ideas on better ways to treat themselves. Grand rounds are a great way to learn, I think, and I don't attend it enough. It's very difficult to go to grand rounds when you're busy trying to make a living. But that's a great way to learn. If you can't go to grand rounds, I think another great way to learn is volunteering in a residency program, dermatology training program. I do that as much as I can, once a week or a few times a month, even once a month if that's possible, if that's all you can do. Being around dermatology residents, I think that's a great way to learn. They're often at grand rounds. That's what got me onto that tangent. But that's a wonderful way to learn. Again, when you talk to other people, you always gain stuff. And that's something that people in private practice like myself, it's where you lose out a bit because you don't have anyone to bounce ideas off to get a fresh set of thoughts about when you're in private practice. When you go in a institutionalized setting and you're not in a location by yourself, I think it's fantastic. I mean, you don't have time when you're seeing 1 million patients a day, but in a situation like grand rounds, where there's time for everyone to chat, I think it's a wonderful situation. And with residents, you're one-on-one with residents, dermatology trainees, that's also a great way to learn. I mean, we're teaching them, but they're also teaching us. And we'll get into that a little bit with mentor and mentoring, which I'll talk about in a few minutes as another great way to learn, I think, that we should all take part of. I'll get to that. So we talked about journals. We talked about, we're talking about changes in disease management and diagnosis and management and therapies. And so we talked about journals, how many we have to read and how important it is to read them because you want to gain that edge, whatever edge you can, and going to conferences like a Grand Rounds. What about other conferences? Dermatology has so many different conferences that we can go to all the time. We have more conferences, I think, probably than, I don't know, than any other specialty. It seems that way. I mean, we have meetings, so many meetings a year. You can have a meeting every week. The ASLMS meeting, I know, is just this past weekend in Denver. A lot of dermatologists went to that. I mean, there's no better way to keep up with what's going on in the laser world than being at that meeting. How else can you learn when you're around everyone who has lasers and all the laser companies? How else can you not learn except by going to a meeting like that? But there's meetings you don't have to go to that meeting, because there's meetings. I mean, I think it's an important meeting, and it's the best one to go to if you do lasers every year. But there's so many meetings we have in dermatology, so much to choose from. I don't even know where to start. We just had, a few weeks ago, the American Academy of Dermatology annual meeting, where there's over 10,000 people, I think, maybe even 15,000 people if you include vendors, pharmaceutical companies. And a third of the people from that meeting, I think, are from out of the country, dermatologists from around the world. They know the value of learning, and they'll come all the way to the United States to learn. We have America. I mean, we're very lucky to be in this country, which is the best place to learn and grow as a physician. The rest of the world learns from us. We can surely learn from the rest of the world as well, but this is where the rest of the world goes to learn. So that meeting is huge, and there's so many learning opportunities at that meeting. It's overwhelming. But again, I think networking is part of that meeting. That's a great one-on-one, networking with our fellow dermatologists and talking about ways they've learned and what they do in their practices. And usually we talk about that from a business perspective more so than talking about individual patients that we have to find ways to help treat. But that's a great way to learn as well. It's amazing. And when you go to these meetings, you go to these sessions, again, stay for the questions. Sometimes questions aren't so good, but you never know when that question will come up. When someone asks a question, but what they learned in that session, you may learn a lot from it too. And I do. Not always. I mean, like I said, a lot of the questions are not so helpful, but you never know when that question will come that will you'll get something out of. I was in at the AD meeting. I chaired a session on acne and hormones and hormones and hair loss as well. It was androgens basically and acne and hair loss. We had a great turnout for that session. And the other people who I asked to speak at that session did a great job presenting the material. I learned a lot from listening in that session, a lot. I mean, these are dermatologists, two of them were way younger than me, very smart, very knowledgeable. I learned a lot. So going to sessions, going to conferences is a great way. Another great way is to give a presentation yourself. When I give presentations, I'm always learning. How can you not learn when you're giving a presentation? Because you have to scour the literature. You have to be on top of your game. If you're giving a presentation to other physicians, you've got to know. You've got to be prepared. And you have to be ready to answer any question that will come and be knowledgeable about that subject. And that takes a lot of preparation and a lot of learning. Doing the research, it's easy to do research these days. Just Dr. Google can answer any question. And then it's up to us to sort through what's relevant and what's not relevant once Dr. Google gives us everything. But it's all there at our fingertips. We have to learn, the relevant sources versus the irrelevant sources, figure that out, but it's all there. And I think giving presentations is another great way to learn. So important. Prepare for presentations. So ask to give presentations. Learn. I personally think being a speaker for example, a pharmaceutical company, a lot of people look down on that you're being paid by a pharmaceutical company, and you're a lackey for them. I look at it as a way to learn. I learn more about that subject, and usually I only do presentations for pharmaceutical companies for ones where I've done the clinical research already, so I'm already familiar with that product. But you become more familiar with that product. You think you know all about that product when you're doing the clinical research on it. You don't. There's so much more to learn about that product. What about the phase 1 studies, the basic science data? So, if you're speaking about that product, you want to know all about the details of that product. And someone who's practicing, and if I'm in private practice, I'm not speaking about that product, there's no way I'm going to have the time. There's so much out there. There's no way I'm going to have the time to learn all about that product. So I relish the opportunity to be a speaker and to speak on subjects and to give presentations over and over, because every time I do, I have to prepare. I have to relearn my dense mind and what I've forgotten, and also learn better how to I have to learn more about that subject, so I'm prepared to give my talk. So I think giving presentations is another great way to learn. So those are non-CME events, and I think doing CME events is important as well at the meetings. I mean, if you're asked to give a presentation at a CME meeting, you're considered the expert in that, whether it be for big pharma or just giving a talk at a meeting. I think that's so important and a great way to learn as well. I was asked a year or two ago in the Acne and Rosacea Symposium to give an update on rosacea. And rosacea is something that I know about and I've done a lot of clinical research about, but it's not something that I know like acne. I know everything in and out about acne. I still need to learn. I'm constantly learning, but I give many more acne presentations than rosacea presentations. But I was asked to give an update on rosacea therapy. And you know what? I learned a lot because I had to research and I had to be prepared. And I wanted to give the best presentation I could give on what's going on in the rosacea world. And I hope I fulfilled that expectation. People ask questions, which is good. You always want questions when I was done, which is important. But that was a great way to learn about a subject. And I think just like, an athlete gets themselves better at their game by doing something they don't want to do, by learning something they're not so good at. It's sort of like a challenge. I take it as a challenge. I want to learn something I'm not so good at. I, years ago, felt I wasn't so good at doing flaps when I was a resident, which is a way, after removing skin cancer. So I took it on myself to do as many flaps as I could and find complicated cases that required flaps. I could have shied away and said, I'll probably never do flaps in my office. But you know what? I wanted to learn. I wasn't so good, I felt, at doing KOH exams. Well, potassium hydroxide exams to check for fungus. I did them over and over and over and over as much as I could. There's no other better way I think, of being good at something, or even not being good, but being adequate at something by doing it over and over and by learning and trying to do it. So we're trying to be the best at it that you can. You may not be the best at it you can, but you'll certainly be far better than you were before. And then you continue to strive to ask questions, do new things, and be the best that you can. I'm sure there's going to be people better than you. There's always people better than me and you. But there's no way of trying to get there and trying to move to the next step unless you learn, unless you keep trying over and over. So that's why I think presentations are a great way to learn. I mean, I can't overemphasize that enough. So let's talk about mentorship a bit for a few minutes before we wrap things up. I think mentorship is as a doctor, something I value the most is mentorship and menteeship, as learning. And Women's Derm Society, I think, is great at doing that. I would encourage all men and women to become members of that, just because it's called Women's Derm Society, and it was started by women, but I think it's really relevant as a mentorship mentee organization, as an organization that gets dermatologists together and and helps us grow. And I think when and you don't need to use that organization. I think it's a great that organization does a wonderful job at mentorship and menteeship. You can certainly do it on your own, but I think that's something we don't use enough. I think every dermatologist, every physician, everyone who wants to grow should have mentors or mentors, and mentees. You start when you're younger, of course, you're more of a mentee than a mentor. My age, it goes both ways. And then when you're older, well, you're the older generation, you can still learn. You can still have mentors that are much younger than you. People think differently, and like I mentioned, you can always learn things from different people. Learn more and more. I've done a few mentorship programs with the ASDS. They call it Future Leaders Network. I think it's a great way for young dermatologists to get involved. And when you're involved in the ASDS Future Leaders Network, you will be matched with a mentor that will help you with a program. You're gonna program a project, and you will learn a lot. You will learn so much. I've done it twice. I've learned so much from my mentees doing that. They're such smart people, and they do such a great job. But our specialty is much better off because of that program. Getting mentors and mentees together to work on projects that better our specialty and ultimately help our patients more. But that's you can have a mentor for not just learning therapies in medicine, but for learning how to do coding and billing appropriately, learning advocacy. I mean, I had a mentor, for example, who got me more into working with the American Academy of Dermatology Association, American Academy of Dermatology. Dan Siegel was a great mentor for me, still is a great mentor for me. Because through him, I learned how to work within the organization, what the American Academy of Dermatology is, how it functions. I learned a lot about the RUC, the Resource Update Committee, I think it's called, which is a part of the AMA that the Congress uses to set prices. If you wonder how, that's a whole nother talk we could do another time. But the prices and the amount of how each code we bill is paid, it gets set at the RUC. CMS has the ultimate ruling on the RUC, but oftentimes it takes what the RUC does. And these are physicians from around the country who come up with what payments will be for certain codes. But I digress. But he was a great mentor to me, and still is, like I said. You never stop learning. I've learned a lot about. There's a really nice person. I have younger gentleman who's interim chair of the department here in DC of dermatology. I learned a lot from him. Very smart guy, and the way he runs things, the way he organizes things, the way he reaches out. Yeah, I would say he's a mentor as well. And then mentees, I mentioned how much I learned from mentees. Wow. I mean, the mentees I've had for the Future Leaders Network and people I've worked with have gone on to do great things, but you learn a lot. When someone's doing a project, you're involved in that project, even as a mentor. You may be not doing the legwork, but you're still learning a lot. You're working with that mentee, and you're moving that project to the next level again. And so you're intimately involved in that project, and that helps you grow as a person. You're asking questions. They're asking questions. So important, like I mentioned, to continue to ask questions. So I can't stress overall the value that being a mentor and mentee relationship does for learning. And I want to go back one thing. I just realized I forgot one thing about talking about changes in disease diagnosis and therapy that I think is important, is to be an author on posters and papers and publications, to write as much as you can. If someone approaches you and asks you to write something for the whatever journal or article they need help with, by all means, if you have the time, do it. You'll be able to ask questions. You'll work. For example, I'm right now, I'm an online editor for one of the journals called The Dermatologist, and I'm a psoriasis section editor. And I've asked people every month, I want to have a new topic covered by on psoriasis, and I've asked people to write whatever they want to learn about when it comes to psoriasis. And we've had great. I mean, I've read everything that the people I've asked who have been kind enough to write for the online edition of The Dermatologist on the psoriasis section. I've asked a few people to write, and so far, since I've been section editor, and the stuff that comes out is amazing. I learned from reading them. They're doing a lot of work. It's a lot of work, and I hope they're gaining from that as well. But I think authorship, if you're ever given the chance to author something, by all means do it. I know we're all busy, but that is a great way to learn, because when you're an author, it's like being the presenter. It's more than being the presenter. You have to know everything. You can never know everything, but you have to know enough to be able to answer questions. Let me put it like that. That's a better way of putting it. So you have to be prepared. And that's all about preparation. So I'm going to summarize now, and I'm going to end with the way I started. And then I'll open up the questions. And I hope as people access this program in the archives that they learn a lot. I enjoyed preparing for it. I learned a lot preparing for it. But I hope it's Why We Never Stop Learning is a very successful archive session. So let me summarize quickly and talk about what we talked about, and then end the way we started before I open up the questions. So we talked about different we talked about why we have to continue learning. I mean, we're physicians. We always have to learn. We talked about its importance is I mean, that's what we are. You can't be a successful physician without learning. We talked about how it's important to keep up to date and learn, and that learning never stops. And there's so many different ways to learn. We talked about being advocates for our patients and learning about advocacy and how that's important. And that leads us into practice management and coding and all the things we have to learn about that and to keep our practices going. And although we hire people to do that for us, that's not necessarily enough. The buck stops with us. We have to take care of things. You know, there's the MIPS, the macro, the MIPS reporting, different coding that goes on, changes in coding. You know, for example, this year we had new biopsy codes we had to learn. We have to make sure we use appropriately. Practice management, you know, how do we learn to handle our patients best? We're really in customer service. We have to learn how to be good customer service for our patients. Yeah, we want to give them the best therapy. We want them to be happy. We want them to want to come back to see us. You know, gone are the days where the doctor is the ultimate authority. We're not the ultimate authority. Dr. Google is the ultimate authority, and we have to, or at least patients think that, and we want to be there and explain why or why not. Dr. Google may not be the ultimate authority, and the only way to do that is to keep learning. We talked about changes in disease diagnosis and therapy, how, you know, in the 20 plus years I've been in practice, therapies have changed dramatically. Things are different, and we need to keep up. We need to keep up with the times, not just the standard of care, but keep up with the times so we can give the best medicines to our patients. We talked about the myriad ways of dermatologists can learn in terms of being active in the American Academy of Dermatology, the ASDS, or the ASLMS societies, going to committee meetings. We talked about going to reading all your journals, going to conferences. We have so many choices in conferences in dermatology. Giving presentations, authoring articles. All those things are so important. And then last but not least, we talked about mentorship. And the importance of mentorship, being a mentor and a mentee at all times is a great way to grow. With that, I'm going to close by reiterating the quote I gave to open, which I think is a key take-home message of learning. Learning is not about, learning is about learning, but it's not about what did you learn today? What can you learn today? It's about what can you learn tomorrow? What questions can you ask of your teachers today or tomorrow, about what you learned? How do you move to the next step? That's why I think that story is so nice that I opened with, where the mother asked the child, didn't ask the child what you learned today. What did you learn today in school? The mother asked the child, what questions did you ask your teacher today? We want to ask questions. We want to learn the next step. We want to try, we'll never perfect. None of us are perfect. But we want to try and achieve that as best we can. And that's, I think, what learning is all about. So with that, I will open up to questions and see if anyone has any questions before we end.
Yes, you talked about the importance of giving lectures. How do you break into the speaking circuit?
So that's a great question. And how does someone give lectures? So I think the way to start giving lectures, you know, there's different ways to break in the speaking circuit, and it's not really a circuit. It's learning about a subject well enough that you're considered an expert in that. And how do you do that? You go to grand rounds, you mingle, you network, you go to meetings and you mingle, you network, you go to sessions on that subject, and you mingle, you network. And that's a whole other session about how to mingle and network, I guess we could do. And then you know everything about that subject. You know as much as there is not, actually, you can never know everything about that subject, but you know as much as you can about that subject. And you ask for opportunities. How can it hurt to ask for an opportunity to give a lecture? But from pharma, they have their speaker bureaus. If you want to be on a pharma speaker bureau, and I think that's a great way to start, is to be an expert on a subject that's from pharma. And like I said, I learn a lot by doing those lectures. Ask your representative, how do I get on the speakers bureau? What would it take? It may take a year or two, but that's a good way to start. Ask dermatologists who are your mentors. How do you get involved in being a lecturer on the subject you want to be a lecturer on? If that's not their specialty, not that their forte, they may know people who are experts or who are big in that subject matter in dermatology that they can put you in touch with. I think that's how you do it. You network and you ask and you learn, and you never stop learning. Hope that answers the question well.
Yes, it did.
All right. Can you think of anything else to ask?
No, I think that covers it.
All right. Thank you very much. So I'm going to thank Aqua Marketing, who are the leaders in digital marketing for dermatologists, for sponsoring this water cooler. I hope, again, people who archive this get a lot from it. And once again, I want to thank everyone for joining. And please access this when it becomes archived and enjoy it. And we have one more water cooler session on the schedule, which we'll do next month on May 6th, and how to be an effective advocate for the community, which we're going to talk about. So we talked about advocacy. That's the theme for this 6 series of water cooler lectures. And we're going to talk about being an advocate around where we live. And there's different types of communities. It can be our dermatology community, which we talked a lot about that. I'm going to try and make it more local. So with that, I want to thank you and for listening, and never stop learning.